Up. When me coming up, I find out that the bag carry me right back down. Come back up again, the bag carry me down. Rough, but I don't dead, so me not try to make nothing get me down. Because I'm done stairs already. Not glad to stay so, and don't glad to stay so. And I like to move around and tell myself that I want to move around and I will move around again. This occasion right now, I barely can move. You have my waist, from my waist go down. The farm.
The farm?
Yes.
Basically crippled?
Yes, basically crippled. There are plenty pain more than anything else. Smash me up at the doctor, I can't stand up for people. Sit down on people and no one then. Alright, out of the 4 here, me check how much time make me stand up on people. Before this heavy rain other day, it was 33 times.
In Office with Dr. Jevon Samuels.
Welcome to another episode of In Office. I am Dr. Jevon Samuels. And in office with me today is Mr. Silverman. And the topic that we'll be discussing today is decompression sickness, also known as the beds. Welcome to the show.
Yes, welcome.
All right. So decompression sickness is a medical condition in which the oxygen gas ever inhaling, deep diving, get trapped in the tissue and expand in the tissue, causing most often not causing severe pain. All right. So normally when a diver goes down, say for example 33 feet, 66 feet, the deeper the diver goes, the higher the pressure is on the body, right? And if we know how gas work is that the higher the pressure, the more gas will dissolve in tissue or fluid. So what happens is that normally when the diver is at deep sea, deep down like 33 feet, 66 feet, even 90 feet, the amount of nitrogen that is absorbed by the body is significantly high. And whenever the divers come back to the surface, then we find out that we normally advise the divers to do it slowly so that he can breathe out the nitrogen as he is coming up, right? But however, for different reasons, sometimes the nitrogen get trapped in the denser tissues of the body, such as the knee joint or other joints of the body, and as well as in the muscles or in other tissues such as the brain as well, right? And so basically it's a disease where the nitrogen gas expand in your body, so it can basically affect any organ system of the body, even though mainly it affects the joints, but it can actually affect, it can kill it, all right? So it can affect the skin, in which we have like rash can develop on the skin. It can affect the brain, which it can lead to dizziness, can lead to unconscious, the patient becoming unconscious, can also lead to death. Likewise, it can damage different organs in the body as well, such as the heart, the lung, and the blood vessels overall. All right? So here with me today, Mr. Silverman is just going to basically go through the different symptoms that he had, the treatment, etc. And so we can get a better understanding of the disease. All right? So Silverman, welcome to the show, as I said before. All right? No. So you're diver by profession, right? So you normally go deep dive. You told me earlier that you dive to 80 feet down. 90
feet, 100 feet, sometimes that. But all right, we catch bends on 85 feet of water. That. And to my belief, which that is deep, but to my belief as a diver, so that's shallow.
Okay.
And me dive deeper than that and catch bends, and not really bends like this, but still bends. And recover it.
All right.
I get to go decompress. And I catch this bends, I don't really decompress.
All right. So tell us some of the symptoms that you're having on this occasion or when you had bends previously.
And this occasion, Doc, I want to tell you about this occasion.
Yes.
This occasion right now, I barely can move. You have my waist, from my waist go down. The farm.
The farm?
Yes.
Basically crippled?
Yes, basically crippled. There are plenty pain more than anything else. When I say pain, that pain, even right now, I sit here talking to you, my 2 legs in here, come right to my knee. Lone pain. You see, tonight, possibly every night, I can't stretch out now, I lay down on the bed. And if it don't get a stretch out, sometimes if it can fall up and come back up like this. So that's a great problem. Give me a lot of pain. String them behind my knee, you draw them right up like this. So that's another problem where I can't move on. Like,
okay.
Waistline, weak.
All right, so tell us, you have dived several times before in deep waters, but what different had occurred on this occasion? Why you think that affected? Is that you came up too fast, or you had challenges?
Came up too fast now. Current is very strong now, and the strong current that I meet that night is a crowd that take me down to the seabed. Instead of to float up, when me coming up, we find out that the bag carry me right back down. Come back up again, the bag carry me down. When I call and find say, supposed to leg of the bag. When I leg of the bag of the bag float, me find me take time and come free. Somebody diver down there, see me, some shape my light, because I'm there above him. Some shape my light and they look up and me tell say, leg of the bag. He say, no, it's alright. But I understand the signal when he goes up. He must say it's alright, you know? So we did this to take time and we come up. Take time with him and the two will come up. When we come up, diver take my captain go from my bag. Go from my bag and catch it and come back, push back with it. He put it on his big toe, take the next diver back because it tow the side outside and float side and take the next diver back, he put my boat on. The diver said to me, say, help him go in our boat. So I help him. Me overboard and help him because the diver way, he ride bike, so he mash up off a bike with all him rider. Okay. So he kind of walk away. So then go in our boat and then if you go in our boat, the captain take up my bag, come on the side, our boat can have a little height. You know? Okay. So I swing up on the boat to go in our boat and go in our boat and everything.
Alright, so what exactly you call the bag that you
the bag that we shoot the fish and put it.
Okay, so shoot the
fish. My fish bag, yeah.
Oh, your fish bag, okay. Yes. So you actually didn't have a gas cylinder there, you had this
the
compressor in the boat.
So I have a hose pan the back and a regulator in the boat.
Okay, getting the oxygen there.
When we go in our boat now, that and the captain said to me, say, Silverman, the diver say, no, I'm go back over. And I said, man, now we just start finding fish even though the current strong. So I said to him. Yeah. So we find them start jumping hose and jump hose, they start more than line up for coming. Okay. That I don't know, so I catch men down that because I'm me go for me sponge up about me, I will lie down pan. Likewise, the next diver, they know that captain full. Lie down in some water. Okay. Even after PJ Bank, still never know some catch men's. And when I come in and catch this party phone can pick up. Me no know some catch men's that because I do everything in that boat for myself, you know.
Alright, so like how long after you came and sure the symptoms started? Sometimes the thing is that the symptoms don't have to start immediately. That some persons up to 24 hours later the symptoms will start.
When we leave PJ Bank and reach a White House, it's that time now my friend, the call on my friend, I don't really remember my name and he come to take out that boat. I said, go for a ride, I catch Benz. So I did lie down, you know. So when I pass my rider that, I get up now to go see which that boat in carry them up with rider now. That me can't get up. I said to the captain, say, Captain, look at me catch Ben, we can't get up. And he said, then Silverman, me never tell him, man, we try to get up again. We feel like I wait to cross my waist here, so. Anyway, my friend carry rider go put in our car. I still not see which car and put him in that. Then he come for the out our boat. When he take me up out our boat, that, by the time we catch out our water and catch panel, I don't know myself.
Oh, I don't know. Alright, so alright. Alright, so the recommended treatment is the hyperbaric chamber, in which I know that it's in Senton in Jamaica we have it. However, sometimes some divers will tell me that sometimes what they do when they realize that they're getting decompression sickness, they ask another diver to take them back down to the level which to release some of the oxygen. So was there
no diver to take me back. And instantly then take me to hospital. Alright, when they take me to hospital, my sister tell me that then take me back out to hospital, take me to Alligator Pond because that time Alligator Pond I live. Take me back to Alligator Pond, that is Sunday night. Monday morning, them have to take me back a Black River again, which I still don't know that we come out of hospital. I don't know, so then take me out and bring me back.
Oh, so you're loss of consciousness?
Yes, man, lost everything that. Everything.
So how many days you're in a coma for?
3 days before me know I'm in the hospital.
3 days?
3 days.
Okay.
In the 4 days now, then send me have to go to chamber. Well, my sister and my police never know jump with me and can't go down in an ambulance. I go down there. Still can't manage it. There's something over my nose back then call it the filter.
Filter?
Yeah. Can't manage it that is a 8 pound and then put over my nose, but then I have to fight it. Until 50,000, 5 hours that.
5 hours there?
I went there 3 times that.
3 sessions?
No movements that.
They didn't get any relief?
No relief at all that. No relief.
Right. So apart from the loss of consciousness and the joint stiffness and pain, you had any other symptoms? Like any respiratory symptoms, shortness of breath?
Yes, sometimes.
Yeah, shortness of breath issue?
Not when I'm in the hospital. Since I come out of the hospital sometimes, I really feel my chest tight. And I know that is here left in another. Okay. And even now, 4 years and 28th of this month, I'm going to make 4 years and 2 months. If I get a diver to take me back out, I see like morning time, sometime morning time. Not all the way, because not every time I will get a diver for the car diver for the diver works here.
Yes.
But I still don't get a diver for the week. So I just there suffering the year that I see and struggling. And that may have me with them going to high school and I have to say rough.
How many children you have?
Yeah, 3 children I get now, 3 girls.
Kids. 3 girls.
Yes.
And they're going to high school.
Yes.
All 3 of them. Oh, so it's affecting your financial because the diving was your livelihood.
What was the livelihood and that they was on take care of my mother, father, me pick them, help my brother and sister them same way. And
Okay.
when I catch Benz, it's rough.
All right. So where you think that they went wrong where all of this is concerned? Because I said this wasn't the first time. Is that this one was more severe than the previous episode?
Yes, this one was very rough. Because after me reach a land, me find out so me can't move. After me can't move and the breaking lift, me don't know myself, so the roughest one is me come through.
Okay, because normally you didn't lose consciousness.
No.
You just have the joint pain and then
Yes, and then get diver to take back out of sea and to decompress back out the ear out of the area. But I don't get no diver from the catches Benz can make that.
okay, so this so it simply means that this is something that happened frequent to the divers.
Yes, something will happen frequent. Then the divers that are Jamaica right now can't walk. They have diver friend now who catch Benz after me. But when they more move, I pick them and the woman have to lift him up, like come put out your side and chair. Finger pee-pee, them have to lift him up, figure put him figure pee-pee. Even right now, this mash me up partner that we can't stand up for pee-pee.
Okay,
No,
sorry to hear.
me have to sit down and pee-pee and no one then. Alright, out of the 4 here, me check how much time me stand up and pee-pee. Before this heavy rain other day,
Yeah.
it was 33 times. Since this heavy rain, I boil some bush like me just lay down and just tell myself I'm gonna boil some bush and drink. When I know
Okay.
can use. And from me start boil bush then, it's about 2 weeks or more drink.
Yes.
It make me pee-pee often, I make me pee-pee clear. I me stand up 4 more times and pee-pee, so that will be 37 times out of 4 years and 2 months. Me stand up and pee-pee.
And then
You must-
apart from that, you have to just sit and wet up yourself.
No, I'm gonna wet up like more people me comes out in my chair. The one side and sits in my chair.
Okay.
Draw them my pants and draw them my underpants and pee like this.
Okay.
Shake the private and jump.
Alright, but normally divers
No,
have
no shame of my no shame of my sickness time.
okay. So normally divers have like some guidelines that they follow, like the rate at which they should surface and at different level, like to release some of the
Yes,
nitrogen at different level.
Me know all
So
that.
you had to follow that guideline. That
Yes,
session?
man. When we floating, you mustn't float just like this, man. You float something. Come up, cross and pile. If you float like this, you will float back in the bubble that you hear that you blow,
Yeah.
and that will cause it to bend totally. But
Okay.
that night, I not lie to you that. I don't know if I float in it or I float beside that because the current very strong carry me down. So we try to come up at top at all time. I'm not penetrating the bubbles when they're coming out whatsoever, but
Oh, so it was hard to follow the guidelines
guideline
that night,
with the
because of the current.
yes.
Okay,
yes.
all right.
Regular
There was an unfortunate incident in which
Yes,
we had no control over.
No control over. No diver that. There's no diver dive to catch bait. No diver at all. Whether you dive shallow or you dive deep, no diver dive to catch bait. And no diver cannot stop themselves from catch bait. Because you don't know when it's gonna catch it.
Yeah, but but since recently, based on if divers follow the guideline, it's far less frequent, far less frequent than before.
That's true.
So I can understand in your case that you didn't have any control because the current was rough there, so you had to just.
And to the truth, that too long me try keep on float. Me tired though. Tired that when me reach at me tired, me blow like this. And me just barely take time I try to float, but the current sucking me down back and I try to force it come up. That's why my diver there 3 minutes after I'm coming out floating dead in my bed.
Oh, sorry to hear. So your
Yes,
partner that
partner
night died.
man, partner died. It's just
Just went unconscious, stopped breathing.
funny come in the boat dock and the captain tell me say, Silverman the diver say he not go back over now. Not more than a year for him. Not more
Yes,
at all.
not going back over.
Yes, and the captain the year, not more for him. And it's after me know myself in hospital now, me know say he diver there. But me I tell myself say he diver the Savlamar hospital and that black river. When me find myself in hospital and gain back consciousness, me I say, right, I must die black river. That Savlamar. No, me that black river. Keep on call the captain when me can use my phone or something.
Yeah.
And captain will dive and say, good enough. All right, after I tell me saying good, he call me one night and says, well, Silverman, well, I can't tell you no lie no more. You know, so right, I did for 3 minutes after I come in the door.
Oh,
Cry out for understand the nurse and come and ask me what man I tell you, I said, the rest of the dive.
okay.
So it's a rough task to go through that.
All right. So you're basically wheelchair bound now. So this had changed your life significantly. You're unable to work. You're unable to walk properly.
Yes, that rough. Right now, I tell you, unable to walk altogether now through the hard way. I have done any walking, I have to take time, come out of the chair, go behind it, and hold on upon it and barely should it. Till when time I feel, I go up on the road and I can't move, or go up and I can't move, I come back home, sit down in it and shoot myself. It's a rough task, man.
Rough task.
As a diver, we used to make the money for help me youth and help myself and help my family see away. I have to turn the little fish cake. Nothing now going right now. Even sitting in my chair here and chop cold chair. I mean, me not dead in that.
Yeah, man.
I know me rough, but I don't dead. So me not try to make nothing get me down. Because I'm done stay so already. Not glad to stay so and don't glad to stay so. I like to move around and tell myself that I want to move around and I will move around again. I never tell myself that I'm not going to.
Yeah, man.
Never ever.
So did you like see counseling or you just have a positive vibes from?
No, me just have a positive vibes, man. Not every one of my friends like who knows me a long time ask me. I said, then Silverman a 4 you catch me and you look so and you reason so and even the day me I talk to a brother and I say, well your voice so like you don't catch me in Silverman, but you know say you're in a wheelchair.
Yeah,
man, I don't make nothing over me that. The only thing more time I just look upon and say, man, I can't run that money to help me with them again and if my sister better would have called for me and say, you know, say more but you know.
Yeah.
Which we know say everyone is on their own, you know, but we have to help one another.
Yeah, man, definitely.
I can't help my family again and it's rough for them for help me. And I was, to be true, that I was the breadwinner in my family. Like, anyone that want a backup to do something, they call on me.
Oh, so you're the breadwinner?
Yes.
Okay.
In a real life. But me still have a sister stand up with me now that. Yes,
Okay.
man. Not 1, 2, but one of them is just like me. I took like a fishing scrape. The other one, a hard working same. But any little sickness like me, sick out and go to a doctor.
To help you out?
Yes, for her phone, me call and she would have said, get a car and go on. Otherwise, me have a friend down here named Kojo. That man out my. Shouldn't say my friend. My father.
Brother.
My brother.
Your brother, alright.
Yes,
good,
man.
Good. Alright. So
Say
they're
it
the ones
again.
that keep you
Say
going.
it again when you see it, if you know.
Yeah,
Shouldn't
man.
say my friend, my brother, my father. Kojo, yes,
Alright,
man.
good.
And the next Rasta from Milk named Dean. I have other help and other sources, but those two, like any little sickness, when we call upon them, man, they never turn me down, man.
Alright.
That's right.
So in terms of relationship now, you're married before?
No,
You had a partner, you live with your partner?
No, before me catch a Benz, my partner did leave.
They break up? Oh,
And you know, say after me catch a Benz, she come back to me and tell me, say, Silverman, you know, say, if you come back and I said, no, sir. Somebody tell me, say, Esteban is why I'm there, so without a partner still. You know, but
okay.
me not like out others, neither that. Go the way, me not like when one of you out other with.
Okay.
So
Alright.
me just stay me and she stay away.
Oh, sorry to hear. Alright, so since then, you never really able to get back into a relationship?
No, sir, because I couldn't get back, but me cannot move around for say work for mine woman and it no make sense me go have a woman around me and me can't work for mine my financing. Maybe that woman could have got all of you or two see where
Okay,
I don't need help. You know, me look just like how me look for myself, me look for the next one see.
Okay, alright, understand them. Alright. So in terms of your kids now, you're not really able to support them properly. So
No.
them mother.
You know, say right now one of our here take our mother sick. So it's just me, yeah, it's just me and one of my brother will help me with him. Because right now my brother really help me sending her to school for my mother there nothing.
Okay.
And the other two now, one of them in a lie that me I tell you it's straight truth. She out hard and when I fight to get her from home and he might tell my sister that he want to listen to some music with. Not right.
Okay.
So my sister tell me, say, no, you're 16-year-old now you want to say you want to go to listen to music. So he said, send back to my father. So Debbie called me and tell me that. My sister me tell say,
Yeah.
Would I say me, no, would I say, she's my caretaker.
Okay.
She care about me like that. Any little thing. I don't want to say that, but I have to really put she at head.
Okay.
Yes, and anyone should see this. When they see this, them are going to know, say, I choose Silverman attack. You have to put me there. Because any little thing at Debbie. Yes, man. Even right now, the little program with the panel, you see them put me on TV.
Yes.
Any little call me get that. If you notice, a fair number I put up.
Yeah, man, definitely.
397 number, yes.
Okay.
All right. So,
Alright.
be sure you say she's with me all along. That little girl now I tell him, say, I want to listen to music. She said, no, you know, girl, say, I want to go in father. I say, Debbie called me, I say, send him come. Debbie say, you know, I'm not going to send him come, but I know you stay. She take up the Debbie phone and call the lady from child care lady come here.
Okay.
Then the other little one now, after I stamp and blow down my little house, blow down the mother house upon.
Yeah.
Mother should have been come give me, because I don't really live at my own house, but I live somewhere. Should have been come give me saying, I want to go work and you can't go home. If I can't go home, so she don't call now nothing. Me no know if she call, well, I ask the little girl if she call, he said no, so mother said she don't call. And you know, come back, I see her back and I try to reach out to you and the child care lady now would say, officer, tell me to forget somebody who can take care of me. We get a person, never got the lady number, but we got the boyfriend number. When we call and give somebody the number, it's not the right child care lady, but the lady take the number serious. Now I talk back to the lady now, she say, she me to give the number. But I never get to call her for another day. So I tell myself, this man, me say me call her. I check today Sunday, so I say me call her tomorrow.
Okay.
Give her the number and make sure she can send somebody to view the place and the house and that. Can't worry about them at homes, and even one will make himself go back there. Don't worry about him saying
The
that.
home, okay.
Yeah,
What happened at the home?
The little one where mother care back. You run from homes and come tomorrow, you know, but when they call me and talk to me, she's right beside me. I'm not like that. I never tell them say she's beside me. We talk as if she not did it.
Okay.
You know, and they say to me, say, Daddy, call them and come for me. Because when they find me, Daddy, I now go come for home still now 18 years old. Call me and come.
Okay.
So me really have to do that. So me will get her still on that, but it's rough. We should get her back already, but through weather severity for when we call them, then tell me say the government not allow them to go out now weather for go out. We get no place enough child.
Okay. All right.
Yeah.
All right. So a part of this program as well is to if any of my guests have any business to advertise or need any assistance, I normally give them like a minute or two just to reach out to the viewers for assistance. So is there any business you're currently doing that you want to advertise or any assistance that you would need? You can just tell the viewers now.
I don't really have no business doing that. Don't want to script to look of fish. But viewers, good evening again. My greatest problem is that storm got out of my house. I don't live anywhere now. Catch up on youth house and it's a problem more time. So the help that I would like is to live back somewhere. If I could get help to build back even one room that, I would give thanks.
Okay.
And in our real life, we kind of get a little call and that and something, but we don't move towards it. So
Okay.
anyone can reach out to me. I still like that and I'm joyful for that.
You can just tell them a number, please.
Okay. My number 804-1539. Right name Larry Lichman, then call me Silverman. I am in Farka Beach. Farka Beach District, Milk Bay, Florida. Bless up viewers.
All right. Thank you very much, Silverman. All right. I remember viewers, remember to share, like, and subscribe to this channel for more informative medical content and life, sickness, and death. And today in office was brought to you from Milk River.
Yes, ma'am.
Milk River Beach. And it was a pleasure being here to basically discuss the challenges and the symptoms of decompression sickness, so other divers out there can actually be aware of things that exist and the symptoms that they should expect, the diving techniques, and also where they have to go for treatment and the cost. And I said 4 years ago, the cost was about $150,000 for 5 hours for decompression.
So it must be more now.
And where exactly did you go? Sentan?
Yeah, Sentan.
Sentan Bay. I believe that's the only machine that they have in Jamaica, Sentan Bay.
And I heard that over the whole globe that we heard hearing about, it's just one here and one here, no more.
Okay.
I never hear about the next one. No,
in this region. In this region, no, they have it.
I don't know.
No, but they have other places in the world, but in the Caribbean, maybe just here at Cayman. All right.
I don't know about here and Cayman.
All right. So until next time, thank you for tuning into In Office.
Bless up, and we'll meet again. That respect that.
Thanks very much.
Be sure to subscribe for more informative contents on life, sickness, and death.